May the blessings of the Triple Gem be with you all. The title of this presentation is Buddhism through the eyes of a doctor. What I have learned, practiced, and taught in a renowned university for the last 35 years has helped me, that scientific perspective has helped me to understand some of the complex concepts in Buddhism. In particular, the works done by three excellent neuroscientists over the last 5 years have tremendously helped me to understand what Buddha described in his philosophy and how the mind works according to exactly what the Buddha described. So, I thought of sharing this experience with you, and so that it helps you to understand the Buddhist philosophy and the principles of Buddhism. I have included my email address at the end of this lecture as well as the next one, and I would like to invite you to give your comments, thoughts, and feedback as to how successful I have been in helping you to understand the principles of Buddhism. The purpose here is not to compare Buddhism with science, but help people who have a basic knowledge of science to understand Buddhism from a scientific perspective. And in explaining these concepts in scientific terms, I will explain to you what happens inside the brain when we meditate. I will refer to the samatha meditation or concentration meditation, and I will also explain to you how the insight meditation or vipassana meditation is used according to Buddha's teachings to achieve enlightenment. I will start the presentation by explaining to you what an optical illusion is. Optical illusion is something that deceives the eye by appearing to be something other than what it really is. For example, all of you will probably understand that what you see here is not a horse, but a formation of clouds that gives the appearance of a horse, and that is what we call an optical illusion. The best example of an optical illusion is when someone is watching a movie. For a moment, think that you are watching this movie, and apparently the hero of this movie is this actor Shah Rukh Khan. Now, while you are watching the movie, all of a sudden Shah Rukh Khan gets shot and he starts bleeding and he is on the verge of death. And you feel sad, sometimes you may start crying, and then you come back to the real world, and then you look around to see whether anybody saw you crying. So, that is an optical illusion again. Unless you become a part of that movie and go inside the movie and be a part of that movie, you cannot enjoy it. Now, the movie, again, all of us know that is optical illusion, optical and auditory. But the most important fact that all of you didn't know is that Buddha described the whole world as an illusion. What we see, what we hear, what we feel, taste, smell, touch, what we cognize or what we know are not true representations of reality. We only see, hear, feel what is in our mind. Now, I will illustrate this with a very simple example. For a moment, think that you are having a chat with your next door lady, your neighbor, and you see your mother and father walking into your house. Now, of course, you are elated to see your mother, and then of course you have a chat. At that point, there are 4 people: you, your next door neighbor, your father, and the mother. Now, for a moment, look at your mother and think you will say, this is my mother. And there are other 2 people who are also watching this figure of your mother. One is your father, and he will of course look at her and think that this is my wife. On the other hand, the next door neighbor, who is not in very good terms with your mother, will get the impression that this is the person that I dislike. So, the point is, the image of this, your mother, image of the lady, seen by all 3 individuals, is an optical illusion, and I will prove that to you in a minute. Now, don't be afraid to see this picture. It is actually what happens in the brain when you see your mother. The light that is reflected from the mother's body goes through the lens of your eye and falls on the back of the eye. There is a screen there that's called the retina. The retina has 2 kinds of cells, the so-called rods and cones, and these cells of course cannot see your mother or see anything. The rods and cones can only see the color and the shape of the object that you see. So, the rods and cones then convert the light energy into an electric current that flows through what we call the optic nerve, the nerve of the eye, to the back of the brain. Now, at the back of the brain, we call that the occipital area. At the back of the brain, the light energy falls in one area that specializes in seeing objects, and the moment it falls on that area, again you have not seen anything here other than the color and the shape of the mother's figure. What happens next is that the brain sends 2 electric currents, one over the top surface of the brain, one over the the bottom surface and collect all the information that you have about the mother into that area, and then it makes a prediction, oh, this could be my mother. And this then is, with that prediction, the brain gets more information and will confirm your prediction to come to the conclusion that this is my mother. These are the two electric currents that go on the upper surface and the lower surface of the brain. This again is another picture that shows how the light travels from the eye along the optic nerve to the brain. Now, once inside the brain is like a black box. We don't know what is happening inside the brain. In the brain processes it and then will recognize, as I told you, like the object as the mother. Then there are certain feelings associated with it. We call that process in Buddhism Vedana. The Vedana or the feelings can be pleasant, unpleasant, or neutral. And I told you that it again, with the feelings, there is also the recognition that this is my mother, and that leads to a certain level of thinking or mental constructs that we call sankhara. And then at the end of the process, combining all these information, the brain makes a final comprehension that is called the mother. So, I describe this process again, the chemical reaction that generates the current and all that, and the brain sends through electric currents to the brain surface, and at the last step is the confirmation and revision of your prediction. Yes, this is the mother. Now, we will apply this concept to the three people who are watching the figure of the mother. I am coming to the conclusion that this is my mother, and my father is coming to the conclusion that this is my wife. My neighbor is coming to the conclusion that this is this is the lady I dislike. The question is, who is right? Now I am going to wear my hat as a university professor, and if I were to give this question to my students, if a few students say all three are right, then at that point I will very sympathetically will give them a C. On the other hand, if somebody says all three of them are wrong, then I will consider them for a A or a B. That is because all three of us, myself, my father, and the next door neighbor, looking at the picture of the mother, came to an erroneous conclusion based on erroneous data, constructs, and mental fabrications based upon our prior experience. Now, that's the neuroscientific aspect of it. Buddha described this 2600 years ago. Buddha said, Sankappa rago purisassa kamo. Lust is just a concept fabricated in our mind with prior accumulation of data. In the mind creates a concept called the mother. Now, every time we see the mother, we see that figure, that faulty data, those concepts that we have stored in the brain makes a prediction that this is my mother. On the other hand, my father makes the prediction that this is my wife, and of course the next door lady says, I don't, this is the person that I dislike. So this is the key to that understanding and knowing that this is a concept, this is an erroneous concept, is the key to understanding and controlling attachment or tanha in Buddhism. The person who has done the most amount of work on this is Professor Anil Seth. He wrote a book, Being You, a New Science of Consciousness. He is the professor of cognitive and computational neuroscience at University of Sussex and co-director of the Canadian Institute for Advanced Research Program on the brain, mind and consciousness. Anil Seth's book, Being You, is what we were discussing a minute ago. This book has won several awards, including the best book of 2021 from Bloomberg and The Economist, and best science book of 2021 by Guardian and the Financial Times, and it also won the Michael Faraday Prize in 2023 from the Royal Society. Again, Anil Seth in this book tries to explain what happens in the brain when consciousness arises. He argues in that book, for example, our sensory experiences of the world, the sights, sounds, etc. that we experience are not really faithful representations of what is outside, but what they are representations of our brain's best guesses. So with this work, Professor Anil Seth won several accolades, and the basic premise here is, the truth here is that we don't see with our eyes, we don't smell with our noses, we don't hear with our ears, we don't taste with our tongue, we don't feel with our body. These sense organs are necessary for us to initiate the process of perception, but the major part of that process of perception is completed by the brain. And there are several scientific studies that prove this point. I just quoted one here. Researchers report, we recognize what we are looking at by combining current stimuli with comparison to images stored in the brain. But before Anil Seth said this in his book, Buddha described the same concept 2600 years ago. Buddha said, Chittena niyati loko. It is the mind that creates the world. and he said the whole world is an illusion. What you see, hear, smell, taste, feel, and think are all illusions. Illusions form a picture of your world, and then you get attached to this world, and that attachment causes suffering. Now, Anil Seth described three aspects of consciousness. He talked about the conscious level. For example, our consciousness level is the deepest, lowest when we are under anesthesia, for example, for surgery. Then Anil Seth also described, Professor Anil Seth described about the conscious content, the sight, sound, smell, emotions, thought, etc. But he described a very important concept of consciousness that is called the conscious self. The specific experiences of being you, the shapeless, formless experience of just being a living organism. And it is probably the most important aspect of consciousness, and that we cling most tightly. Seth identifies our body as the main representation or the embodiment of conscious self. In Buddhism, that same concept is what we call Sakkaya Ditthi, or the self concept. According to Buddhist teachings, clinging to the components of perception, what we call the five aggregates, believing them to constitute a permanent and absolute entity like I or me, is what is described in Buddhism as Sakkaya Ditthi, and that can eventually result in suffering and continuous existence in the consistent existence of the cycle of birth, death, what we call samsara in Buddhism. Now, I will come to another scientist who has done a very significant amount of work on the self concept of Sakkaya Ditthi, and that is Professor Joseph Pavisi, Professor of Neurology and Neurological Sciences at the Neurosurgery Department in Stanford University. And in his work, Dr. Pavisi describes, he remembers meeting one man with epilepsy whose seizures were somewhat very different from the others and had very unusual symptoms. Now, I-ness is the feeling that you indeed are occupying your body. Me, according to him, is everything that has to do with I, the mental narrative about oneself based on one's past experiences. He said this patient came into my clinic and said, whenever I have a seizure, my sense of self is changing. And he said, whenever I am having a seizure, I feel like an observer to conversations that are happening in my mind. And I feel like I am floating in the air. So, Professor Pavisi and his team of researchers, what they did was they looked at this person's focus of the seizure. The seizures start usually at one point inside the brain, and they found a little sausage-like area piece in the brain that was as the point at which uh, this patient's seizures started, and they came to the conclusion that it is the area, it is the part of the brain that is critical for identifying or defining what bodily self is. So, what they did was they collected a series of 9 patients with similar symptoms and placed electrodes, wires going into the brain to that area which they described as nucleus precuneus, and delivered the electric current or pulse of electricity. And lo and behold, when they delivered that electric current to that little sausage-like piece in between the two hemispheres, the right brain and the left brain, all these patients said that it changed their sense of self. They described that it was like an out of body experience. They felt like they were floating in the air, looking at their own body, and their own thoughts were the body and their thoughts were no longer anchored in their body. And this was, they just thought that they were kind of floating out in the air, what we normally describe as an out of body experience. Now, that is, with that information we know this is the part of the brain that controls the self concept or Sakkaya Ditthi. Now, I will go into another sutra from Buddha, the Rohitatsa Sutra. In this sutra, Buddha, a deity named Rohitatsa, comes to Buddha and asks him a question. My Lord, is it possible by traveling to know or reach the end of the universe, where there is no birth, age, death, or passing away? Buddha answers this question in some sort of a riddle. Buddha says, I will tell you, my friend, it isn't possible by traveling to know or to reach the end of the universe where one doesn't take birth, age, or death, passing away and again rebirth as a happening or as phenomenon. But then at the same time, Buddha told the deity, I will tell you that there is no making to the end of the suffering without reaching the end of the universe. So that's how it becomes a riddle. Then Buddha goes on to explain to this deity, it is in the fathom-long body, the 6 feet body, with its perceptions, consciousness, that I declare there is the universe, the origination of the universe, the cessation of the universe, and the path of practice leading to the cessation of the universe. In other words, Buddha saying that the whole universe is this fathom-long body reduces the whole sensory experience, the whole universe, into six sense organs: the eye with the visual objects, visible form; ear with sound; nose with smell or odor; tongue with taste; the body with tangible things we can touch or feel; and the mind with thoughts and ideas. Now, this is my opinion. This is the only slide where I express really my opinion without any reference. My opinion here is that without dwelling much into the structure and the functioning of the sense organs, Buddha analyzed the process of perception and reduced it to 5 components: body, feeling, recognition, thoughts, and consciousness, what we call the 5 aggregates. This is probably because the sense organs are not very well developed in some realms, and therefore I think Buddha decided not to concentrate on the sense organs, but he decided to focus on the process of what happens during perception. And for example, we know that in the animal realm, the bats have very minimal visual capacity, but they have very well developed ears, and they fly by with sound waves that are reflected from different objects. And in the same way, dogs are colorblind. They have a very poor sense of vision, but their smell is very well developed, and that's why we use them as for searching for drugs and searching for individuals when there is a disaster, and we search for individuals in the rubble. Now, in many sutras, Buddha described the sensory process of 5 aggregates. One such sutra is the Honey Ball Sutra or the Madhupindika Sutra, in which he clearly describes what happens when we see an object, when we hear, or when we smell things. For example, here he said, dependent on the eye and the object arises eye conscious, and with our attention focused toward that arises eye consciousness. And that process we call contact. Buddha says, Tinnan Sangati Passo. Then he said, what we contact, we feel. What we feel, we recognize, we perceive. What we perceive, we think about. And what we think about, then he said, we not only just think about, we let our mind proliferate, and it goes, we keep on creating thoughts and going from one thought to another, and Buddha calls that process prapancha. And then he says, when we proliferate, we dwell into those proliferations, and those proliferations, what we dwell into, becomes the shape of our whole world, that illusory world, and the shape of the mind, then he says, becomes the shape of the world. So, as I described, Buddha reduces the whole sensory experience into 5 processes or 5 aggregates. The first is the material part of it, things that we see or the eye that we use to see, and those are things that we can touch. That's what he calls rupa. Then the rest of it, which I have described here in a different color, is what happens inside the brain. And I already referred to this. There is the Vedana or the feeling, there is Sanya or recognition, there is Sankara or thoughts and mental constructs, and we put all these together to get a comprehensive subjective understanding of the object that is the focus of our attention. Let me describe to you in very simple terms what happens, how the 5 aggregates work when we see something or when we hear something, but I will use a visual example. Imagine you are taking a walk in the park and something comes in contact with your eyes. That is your eyes, and there is a visual object that is the rupa component of the visual process. Then you focus your attention on that object and eye consciousness arises, and then you recognize this little thing that you saw while you are walking in the park as a little duck. That is the process of recognition or perception. Then you have, at the same time, you have a very, very compassionate, very pleasant feeling about the duck, and then you start thinking about it. That is what you call sankara. You then think about, maybe you want to touch the duck, and then all of a sudden your mind starts proliferating. You think about bird flu. Oh no, I should not get close to the duck, and mind keeps on working that way. So this is an example of a real life experience that illustrates the 5 aggregates in action. Now I want to focus a little bit more on Vedana or the feeling, and we know in neuroscience that these feelings, pleasant, unpleasant or neutral, are mediated by various chemicals. Here these are the brain chemicals that mediate the feeling of happiness: dopamine, serotonin, oxytocin and endorphin. Your brain, when it's making a prediction, expects, say for example, you're thinking this could be the mother, then you are expecting a reward. The neural pathways, your cells in the brain start secreting dopamine, and once you recognize that as your mother, the secretion of dopamine stops, and then you have to now keep on looking at it, and so dopamine stops once you get what you seek. So you always have to do more to get more. This is the whole mechanism behind tanha or attachment. Same way, if you take the example of the mother, what triggered the maternal love is this chemical in the brain called oxytocin. And oxytocin is quickly metabolized, it's quickly broken down, so you now have to get more and more and more. There is another chemical called serotonin, that's what we call the pleasure chemical. Again, these chemicals are disintegrated in a millisecond inside the brain. So that attracts that feeling, the pleasant feeling is like drug addiction. You Your chemicals give you a high, but they are broken down immediately, and this happens in not just 1 second but 1 millionth of a second, and then you need more and more and more of these chemicals, and that is the neuroscientific basis of attachment or tanha. On the other hand, the unpleasant feelings are mediated by another neurochemical called cortisol. And again, these chemicals warn you. See, the cortisol is more involved in trust and betrayal, and they warn you not to trust the same source again under future circumstances. Now, this is a very important concept. When it is the brain chemicals that mediate the attachment or tanha, and then I am quoting here Reverend Mantani Putta Punna, who was coaching Reverend Ananda, who is the Buddha's main caregiver. And Reverend Mantani Putta Punna says he is helping Reverend Ananda to achieve Sotapanna, or the first stage of enlightenment. He says, my friend, it is with clinging, my friend Ananda, that there is this I am. And when there is no clinging, there is no I. Then he asks, clinging to what? Clinging to form, clinging to matter, clinging to rupa, clinging to feeling, clinging to perception, clinging to mental formations or sankara, and consciousness. If you cling on to these concepts, usually what happens is that when you have Vedana with the chemicals, you not only cling to Vedana, you cling to the whole sensory experience that gave you that pleasant feeling. So you cling on to matter, you cling on to feeling, you cling on to perception, you cling on to mental perception, and you cling on to consciousness. And that is what creates this concept of Sakkaya Ditthi, the concept, the feeling of I and I am. So as we cling on to the 5 processes of perception, what we call 5 aggregates, the 5 aggregates now become my aggregates. The rupa becomes my rupa, Vedana becomes my Vedana, Sanya or recognition becomes my recognition, and thoughts and mental constructs become my constructs, my thoughts, and the consciousness becomes my vijnana, my. And this is how the 5 aggregates become the 5 clinging aggregates. Buddha calls that Panchupadanaskandha in Buddhism. And then Buddha says, Sankittena Panchupadanaskandha dukkha. He describes various components of dukkha: birth, aging, death, old age, all that. I mean, you don't need the Buddha to come and tell us that these things are suffering. But on the other hand, it is that this profound teaching of the Buddha, that the 5 clinging aggregates are the core of that suffering. And here Buddha describes the futility of the 5 clinging aggregates. This is very well spelt out in this book called Magic of the Mind by Reverend Katukurunde Jnanananda, one of the greatest contemporary Buddhist scholars who passed away recently, but who I had the privilege, the merit of treating and associating with. In his book, The Magic of the Mind, Reverend Jnanananda, he quotes Buddha saying that feeling is an air bubble, perception, these are the 5 aggregates, remember. Perception is like a mirage, formations or thoughts are like a plant and tree. Plant and tree is a tree without a bark. It's a tree that is of no use. And then he goes on to say, consciousness is like a magic show. And his book, The Magic of the Mind, is entirely based on this. He says consciousness is a juggler's trick. Again, you have to now go back to how we develop this concept of 5 aggregates. In the Rohitasa Sutra, Buddha said the whole universe can be reduced to the fathom-long body. Then he makes a clever suggestion that it's the 6 sense organs are the ones that experience the whole universe. Then he reduces the 6 sense experiences and to 5 aggregates, 5 components of that perceptual process, and then he goes on to describe these. It is when we cling on to it as I or mine that it creates suffering. And then Buddha, so now you have a good understanding of what the illusory world is like. And what happens is that we see, hear things through our sense organs, but what really happens is that there are these 5 processes or 5 aggregates of perception, and we, with clinging that is mediated by the brain chemicals, we cling on to it and create a person called self. And then Buddha describes how to get over that illusion, the illusory world. And he describes this, Buddha describes this in a sutra called Panchavaggadayaka Brahmana Sutta, where he says, Sabbaso nama rupasming yassanati mamaitang asatacha nasochati save bhikkhuti vucchati. Brahmin, the one who is living not attached to not attached or conflicted by the nama. Here he describes the mind, the 4 components of perception, recognition, thoughts and consciousness. So that is the nama part of it, and or the rupa, or the objects of sight, vision, smell, etc. So he says one who is living not attached to or conflicted by the 5 aggregates and does not lament over it, taking it to be me or mine, is called a bhikkhu. He is describing to this Brahmin who a bhikkhu is. To summarize, Buddha instructed us to look at every sensory experience, that means the whole universe, as nama rupa, or body and mind, or 5 aggregates. These 5 aggregates arise and cease at such a rapid rate, it gives us the impression that these things are what we see, what we hear, what we feel are all permanent. And these 5 aggregates arise, cease, and they only last till the causative factors that are responsible for these 5 aggregates last. And when those causative factors cease, the 5 aggregates also cease. This is what Buddha calls yoniso manasikara, or the way of wise attention. On the other hand, the uninformed ordinary people think of, superimpose a fictitious entity called me and I on the 5 aggregates, and as a result, every one of those aggregates become mine. And the object of attention of those 5 aggregates become my objects or my individuals that are close to me or mine. How we convert from this unwise attention or ayoniso manasikara to the wise attention that Buddha described will be the topic of the next lecture. May the blessings of the Triple Gem be with you all.
To catch the full program and more, subscribe to MMC TV USA on YouTube. Follow us on Facebook, Instagram and TikTok